Hi, I'm Joe Fifer, President and CEO of HFMA. Welcome back to our web video series. This month, I'm talking about the true meaning of value. Yes, we covered the definition of value back in 2011 in our early value project research. The value equation is pretty straightforward. Value equals quality over payment. But quality is a composite that means different things to different people. As a result, so does value. Now there is research from the University of Utah Health that confirms it. Patients, physicians, and employers interpret value differently. We may not realize we're out of sync though. We use the term value so often we don't pause for a reality check to make sure we're all on the same page. So value is starting to lose its meaning. It's creeping into buzzword territory, which is never a good thing. Delivering value to care purchasers is a fundamental principle, not a passing fad. For one thing, out-of-pocket costs are much more important to patients than to physicians, according to the Utah research. In fact, out-of-pocket expenses are even more important to patients than improving their health. But to most physicians, nothing beats health outcomes. As you may remember, our value project work defined healthcare value for patients as encompassing 4 quality factors: access, which includes affordability, safety, respect, and outcomes. Looking at value through a patient's eyes, it's understandable if people with high deductible health plans reduce their utilization so they can save on out-of-pocket costs, even at the expense of managing their chronic conditions. Looking at value through a physician's eyes, it's understandable if they don't realize how much of their patient's behavior is driven by their out-of-pocket costs. Here's the Utah researchers' advice on this. Quote, "Stop, listen, and learn. The most effective thing we can do to create a high-value healthcare system is to pause in our independent pursuits of value to describe to each other exactly what we are seeking." End quote. I couldn't agree more. When I was at Spectrum Health, our Patient and Family Advisory Council, PFAC, provided a structure for talking with patients about all kinds of issues, and we made good use of it. Most healthcare organizations now have some kind of structure in place for engaging consumers, ranging from PFACs to website portals. Sure, there are obstacles that need to be dealt with. We don't have the staffing, resources, or expertise in consumer engagement that we'd like to have. But the biggest obstacle is culture change. We're just not accustomed to free and open exchanges of ideas and perspectives among patients, physicians, health system leaders, and health plans. Each group is locked into its own role and its own way of looking at the issues. We need to find ways to open lines of communication and keep them open. Together, we can build a healthcare system that reflects a shared vision of high-value healthcare, not an empty buzzword. Thanks for watching. I'll see you next month